Hello, Tom Lavecchia here with the latest edition of the New Theory podcast. I'm here today with a very, very, very special guest. We are going to discuss, are breast implants really safe? And we're going to discuss the most recent recall by Allergan, which is the largest producer of breast implants in the world. We're here with Dr. Matthew Trovato, who is a board certified plastic surgeon. He is an expert in all things breast, if that's fair to say. And he's a great guy as well because I know him personally. Matthew Trovato, Dr. Trovato, welcome to New Theory Podcast. How you doing today?
Thank you, Tom. Great. It's nice to be here.
All right. Aside from being strikingly handsome, I'll put a picture of the guy. This guy knows what he's doing, and he's got an excellent background. So why don't you credential yourself a little bit and give a little bit about you?
Okay, sure. I'm a board-certified plastic surgeon. I have fellowships in microsurgery, hand surgery, and craniofacial and pediatric plastic surgery. I've been in practice for about 10 years. And do everything from reconstructive adult and pediatric to cosmetic adult surgery. And as the years have gone on, I do more and more of the boutique cosmetic surgery. Spend a lot of time doing men's plastic surgery, do a lot of hormone replacement and men's wellness, performance oriented modalities, and just happy to be here talking to you, Tom.
Awesome. Wow. I feel dumb after hearing that. So at any rate, with that being said, okay. So let's first talk about Allergan released a recall for breast implants. Why is this such a big deal?
Okay. So breast implants, silicone implants in general, have always been an issue in and out of the media. If you think back to the 1990s, there was a moratorium placed on the silicone implants because they thought that if they leaked, that would cause lupus and autoimmune diseases and cancer, and that all turned out to not be true. So they allowed silicone implants to go back onto the market sometime in 2007 or 2008, and since then the technology has evolved very, very rapidly. The main producers of the implants are constantly upgrading the shell of the implant and the cohesive nature of the solid silicone inside, and the texture has always been an issue in order to try to avoid something called capsular contracture. So the thought was that by creating this textured type of implant, that would avoid one problem. The only issue is now they're starting to possibly realize that the texture could be creating a different problem. That problem is otherwise known as ALCL, which is a type of lymphoma. It's extraordinarily rare even in the world of breast augmentation, but the fact that it's significantly higher than in a patient that doesn't have those implants, that's what's making it a big health concern now. And so Allergan 2 or 3 days ago released their recall of the BioCell textured implant.
Okay, so I mean, listen, I worked in pharmaceuticals for years, over 20 years in pharma and device. Generally, you don't just do a recall for no reason, right? So what was the alarm? Was it, again, you said relative to smooth, right? So smooth is out there, still
Right.
safe, still
Right.
efficacious, and not
Right.
getting touched. But the texture, is getting recalled. So who gets textured? Is this kind of run of the mill or more reconstructive? And number two is, were you using them and stopped, or something you didn't do? Just walk us through the whole history.
Sure. The choice between smooth and textured implants was just more of a surgeon preference. They tend to be more utilized in reconstructive or reconstruction for breast cancer. But there was a style of implant, namely a anatomic shape, more of a teardrop shape implant that was always textured, because if the implant is not round and it has a certain shape to it, you don't want it moving around and turning upside down, whereas a smooth implant, a round implant wouldn't matter. And so they developed these textured implants, and they did great and they look great, and it's a very natural look to the implant. So I've used them many times, more in reconstructive than in cosmetic, but in the right type of patient, they're a great option. It's not all textured that we're talking about, though. There's a specific type category of Allergan textured implants that were recalled, and that's BioCell. And so other companies, Sientra, Mentor, still have textured implants. Those haven't been recalled. Maybe they will if the data supports it. But for right now, there's just a very tiny uptick globally in the number of these cancer cases, and they seem to have a association with that texture. So that's why Allergan's, doing the right thing, really.
So separate from that, and I actually know the CEO of Allergan. He was with Charing Plow. I was there years ago. Very ethical guy. Very ethical company. They're doing what they can, and again, they're following their rules. So with that being said, though, okay. So and also, you and I talked a little bit about, and this is a little separate note, is explanting. People are taking their breasts out. Millennials are organic and farm grown and all that kind of fun stuff. So there's also a little bit of an underbelly of, hey, I want my boobs out. I don't know if you saw Jennifer Stano. She's an influencer online. She took them out after a number of years and had a big uproar as a result. So give us a little bit about the underbelly of explanting or removal of breast, separate from the Allergan recall.
Absolutely, Tom. There is a concurrent movement here, and I don't think that there's a cause and effect. I think it's just coincidence, but these two ideas do overlap. There is a very large contingent of very social media aware patients out there that are able to communicate with one another about random and unexplainable symptoms that they've had since getting their breast implants. And so there's a lot of attention now into removing the implants, and the surgery the name of the surgery is called explantation. And when you do an explant, you also want to remove the capsule that the body produces that surrounds the implant. And so that's kind of a big buzzword right now in plastic surgery. A lot of doctors are offering this, what we call en bloc capsulectomy with implant removal. The issue with that is now you have a breast that is now a quarter of the size of what it was when you had the implant. And so now what do you fill that space with? How do you manage this empty envelope of skin? And so that's something that I've taken a lot of time to really try to perfect or develop several methods in order to try to deal with that exact patient population. And so it's pretty satisfying to see the results. And we just want patients to know that if they do decide to explant, there are multiple options for them that do not involve an implant for them to still have a nice, perky, round, nicely projecting breast.
Okay, so you bring up a great point because I don't know. If I was in this situation and I had to get it removed, don't get me wrong, if the smooth are the way to go and that's, approved by the FDA, why not? But I would like to explore the specific options. And you and I discussed some of those options. So give us like 3 or 4 options outside of just taking out the boob. What can you do to actually replace that volume, or what can you do to achieve an aesthetic result?
Sure. The first option would be, as you mentioned, replacing it with a smooth, round implant. But assuming that you already had a smooth, round implant and you just want it out because you feel like it's, creating issues for you of any kind, then the first option that I would recommend, and if you're a candidate for it, would be a mastopexy, which is a breast lift. In that case, we basically tailor the redundancies of skin and elevate the nipple areolar complex into a good position with just the volume that you already have. And many patients still have a reasonable amount of volume left after removing the implant. The second option is something that I developed called an auto augmentation, meaning it's all your own tissue. So an auto augmentation mastopexy, in which instead of just tailoring the skin, there's a means by which we can de-epithelialize the skin and retain the volume that skin provides. And that gives the patient an additional 20 to 25% volume over just the mastopexy alone. The third option would be doing that auto augmentation, but in addition, doing liposuction to other unwanted areas on the body, sculpting those areas, processing the fat and using that fat as what is otherwise known as a fat graft, and basically implanting that fat into the breast area to provide an additional 15 or 20% volume. So between the auto augmentation and the fat grafting, we have 30 or more percent volume than we would have had otherwise. And for many patients, that is sufficient. I won't go into too much more detail, but beyond just the fat graft, we have methods by which what I like to call biocharge. We can add aspects to that fat graft to make it healthier and have less resorption. And we use PRP and stem cells and other things to try to do that. But we can talk about that in a separate conversation.
So if somebody goes to see you, there's options for there. Hopefully other surgeons are as trained as you if they go locally, that they can go ahead and explore those options. So, how big of a deal is this? I mean, so there's about 250,000 breast augments per year. Of those, was this a big market share? Was this a small portion, as far as you know, of the total market?
I think nobody really has the answer to that, but we can sort of guesstimate, because when we look at social media and we see all the various platforms, chat rooms, sites where women are congregating and discussing what their symptoms are and such, we know that there's several thousand patients, across the country that are out there talking about this, and so there's probably tens of thousands of patients that are looking for an alternative.
So as far as you know, let's say somebody's listening to this and they have breast implants, or if they know somebody who does, which they probably do, what are some of the symptoms to look out for of this rare disease?
Sure. The symptoms are, you could say that they're relatively vague, but you know what? Anytime you have breast implants and you have certain symptoms, you just have to be cued into them more than the average patient. So swelling in your neck, under the arm, the axilla, the groin, those would be the first signs. Painless swelling in any of those areas. And that is because the lymph nodes are actually accumulating some of these lymphoma cells. And so that would be a cause for concern. But I would also recommend that anybody that's even thinking about it, see their local plastic surgeon. And if that surgeon is not really comfortable with the options that we discussed, to seek out an expert or a specialist or somebody that has a particular interest in the area.
Interesting enough. And what struck me was, and again, listen, I'm a Gen Xer, and growing up, if you got like a boob job, you kind of weren't necessarily, it was bad or negative, but there was a little bit of a negative connotation if you got a boob job. Nowadays, it's categorically different. Who does get boob jobs? It's not necessarily strippers and girls looking to get bigger breasts. Like, these are regular, professional, like, I want to say strippers are bad people, but what I'm saying is there was a negative cachet kind of growing up with boob jobs.
Yeah.
And that's since been gone. Who does get boob jobs?
Well, I'll tell you, this is just my own personal opinion, but I think since the technology of the breast implants and the techniques that surgeons have learned to use have evolved, the breast implant patient ends up with a much more natural result than what you would have had, say, in the 1980s.
Interesting.
Where that stripper or dancer that you referred to, there's a certain look to that breast, and that's because it was only saline implants, and the shell of the implant was not very soft, and the implants were placed in the subglandular, not submuscular location, so it gave this very, very characteristic look, whereas now you could use a smaller implant that's cohesive gel, very natural looking, and no one would ever really even guess. And so that's why I think it's become much more accepted, widespread, and common.
Interesting. Listen, Dr. Trovato, it was exciting to have you on. You could find him at NewJerseyPlasticSurgery.com. I will go ahead and I will put a link to the website so you can find Dr. Trovato pretty easily. Are you on social media at all?
A little bit.
All right. Can we find you on social media, or we'll just direct them to the website?
We would direct them to the website. I have an Instagram page, but I don't pay too much attention to it. But the best interaction for patients is just meeting that plastic surgeon face to face and establishing that trust. Our office number is 973-509-2000.
2000. And NewJerseyPlasticSurgery.com. And for New Theory, we cover a lot of aesthetic topics. So if there's anything you want to send it to me, Tom, at New Theory, we'll be happy to send it on to Doc. And Dr. Trovato, thank you for being on the New Theory podcast.
Thank you, Tom.